Welcome to our YouTube channel Medical Subjects Made Easy. Today's topic is drugs used in treatment of pulmonary edema. Pulmonary edema is a condition characterized by the accumulation of fluid in the air sacs of the lungs, leading to difficulty in breathing. It can be caused by various underlying conditions such as heart failure, pneumonia, acute respiratory distress syndrome, ARDS, kidney failure, or high-altitude sickness. The treatment of pulmonary edema focuses on relieving symptoms, improving oxygenation, and addressing the underlying cause. Several drugs are commonly used in the management of pulmonary edema, and their dosages may vary depending on the individual case and the severity of the condition. Here is a detailed list of the drugs used for treating pulmonary edema. 1. Diuretics. Furosemide, Lasix. It is a loop diuretic that promotes urine production and reduces fluid volume. Dosage. Initial dose of 20 to 40 mg orally or intravenously, may increase up to 160 mg if required. Bumetanide, Bumex. Another loop diuretic that has similar effects to furosemide. Dosage. Initial dose of 0.5 to 1 mg intravenously, may increase up to 10 mg if required. 2. Vasodilators. Nitroglycerin. It dilates blood vessels, reduces preload and afterload, and improves oxygen supply to the myocardium. Dosage. Administered intravenously as an infusion starting from 5 to 10 mcg per minute. Titrate the dose upwards for symptom relief. Sodium nitroprusside. It is a potent vasodilator that reduces afterload and improves cardiac output. Dosage. Administered intravenously as an infusion starting at 0.25 to 0.5 mcg per kilogram per minute, gradually increase up to 10 mcg per kilogram per minute. 3. Inotropic agents. Dobutamine. It improves cardiac contractility and increases cardiac output. Dosage. Initial dose of 2.5 to 5 mcg per kilogram per minute intravenously, may increase up to 20 mcg per kilogram per minute if required. Norenone, a phosphodiesterase inhibitor that increases myocardial contractility and vasodilation. Dosage. Initially, a loading dose of 50 mcg per kilogram intravenously over 10 minutes, followed by continuous infusion at 0.375 to 0.75 mcg per kilogram per minute. 4. Oxygen therapy. Supplemental oxygen is provided to improve oxygenation and alleviate respiratory distress. The delivery method may vary, including nasal cannula, face mask, or noninvasive ventilation. 5. Mucolytics and bronchodilators. Acetylcysteine. It helps in thinning and loosening mucus secretions, making it easier to clear the airways. Dosage. Usually administered by inhalation as directed by the prescribing doctor. Albuterol. A bronchodilator that relaxes the airway-smooth muscles, allowing easier breathing. Dosage. Usually administered using an inhaler or nebulizer as prescribed. It's important to note that the dosages mentioned above are just general guidelines and may vary depending on the patient's individual condition, the severity of symptoms, and the doctor's discretion. It is essential to consult a healthcare professional for accurate diagnosis, treatment planning, and appropriate drug administration.